March is Brain Injury Awareness Month. We're here with Dr. Michael Lawrence. And what is a brain injury?
A brain injury is typically something that causes disruption to brain function, and it can be caused by oftentimes a direct blow to the head, but also a blow to the chest or other areas of the body that causes transmission of force to the brain.
How are brain injuries diagnosed?
Sure. Well, oftentimes, if an individual falls and hits their head, they may experience things like loss of consciousness, some confusion, memory for the events may be clouded, and oftentimes then they'll go to the emergency room. And in the emergency room, they're assessed through a physical examination, but it may be other imaging, such as a CAT scan or an MRI, to look at bruising, bleeding, or swelling to the brain.
What exactly happens to the brain when it's injured?
Sure. Well, it depends upon the type of impact and the significance of the force. In mild traumatic brain injuries, it's often thought to be a chemical change to the brain that occurs. More significant head injuries, you can have bleeding and bruising. The elderly are actually most at risk because of the brain shrinks as you get older, and you have these bridging blood vessels that become taut and they can burst quite easily.
During the month of March, Spectrum is having a bunch of screenings that are taking place, and it's to raise awareness about brain injury. Tell us more about those.
Sure. Well, we've had ongoing screenings throughout the month of March, and these are in the Grand Rapids and surrounding areas. And really what we're attempting to do is not only raise awareness, but also assess fall risk, because fall is one of the most common causes of head injury, particularly in children and the elderly.
Oh, that's really interesting. So really anybody can come out because it's free. It'll be assessed.
Anybody can come out and be assessed, and they'll have their dynamic and static balance assessed. And if there is balance-related difficulties, then we can refer them to appropriate rehab to prevent falls and other types of injuries.